Welcome to the Executive Order Audio Library, where we read Trump's executive orders so you can listen to them at your leisure and stay fully informed about what they contain. If you find this resource helpful, please like this video so others can find it too. I'll be reading another hotly contested executive action today. Some people say this executive order is about safeguarding children from irreversible medical procedures and lifelong medicalization they might regret later, especially at some point in their adulthood when they are fully able to understand the ramifications of these procedures and have lived experience living, thinking, and trying to navigate the world as a truly independent adult with their own identity. Others argue trans rights are human rights, and this executive order is discriminatory. They feel it restricts access to necessary health care for vulnerable kids. Executive Order 14187 prohibits federal funding for gender-affirming care for individuals under the age of 19, including surgeries, puberty blockers, and hormone therapy. Supporters point to global shifts in policy like England's response to the findings of the Cass report and concerns raised by the leaked WPATH files as clear evidence that stricter guidelines are needed. Critics argue this undermines the rights of transgender youth and their families, and that this order comes from a place of bigotry and discrimination against an already vulnerable population. This is a reading of Executive Order 14187, Protecting Children from Chemical and Surgical Mutilation. By the authority vested in me as President by the Constitution and the laws of the United States of America, it is hereby ordered. Section 1. Policy and Purpose. Across the country today, medical professionals are maiming and sterilizing a growing number of impressionable children under the radical and false claim that adults can change a child's sex through a series of irreversible medical interventions. This dangerous trend will be a stain on our nation's history, and it must end. Countless children soon regret that they have been mutilated and begin to grasp the horrifying tragedy that they will never be able to conceive children of their own or nurture their children through breastfeeding. Moreover, these vulnerable youth's medical bills may rise throughout their lifetimes, as they are often trapped with lifelong medical complications, a losing war with their own bodies, and tragically, sterilization. Accordingly, it is the policy of the United States that it will not fund, sponsor, promote, assist, or support the so-called, quote, transition of a child from one sex to another, and will rigorously enforce all laws that prohibit or limit these destructive and life-altering procedures. Section 2. Definitions. For the purposes of this order, A. The term child or children means an individual or individuals under 19 years of age. B. The term pediatric means relating to the medical care of a child. C. The phrase chemical and surgical mutilation means the use of puberty blockers, including GnRH agonists, and other interventions to delay the onset or progression of normally timed puberty in an individual who does not identify as his or her sex. The use of sex hormones such as androgen blockers, estrogen, progesterone, or testosterone to align an individual's physical appearance with an identity that differs from his or her sex, and surgical procedures that attempt to transform an individual's physical appearance to align with an identity that differs from his or her sex, or that attempt to alter or remove an individual's sexual organs to minimize or destroy their natural biological functions. Section 3. Ending reliance on junk science. A. The blatant harm done to children by chemical and surgical mutilation cloaks itself in medical necessity, spurred by guidance from the World Professional Association for Transgender Health, WPATH, which lacks scientific integrity. In light of the scientific concerns with the WPATH guidance, 1. Agencies shall rescind or amend all policies that rely on WPATH guidance, including WPATH's Standards of Care, version 8, and 2. Within 90 days of the date of this order, the Secretary of Health and Human Services, HHS, shall publish a review of the existing literature on best practices for promoting the health of children who assert gender dysphoria, rapid onset gender dysphoria, or other identity-based confusion. B. The Secretary of HHS, as appropriate and consistent with applicable law, shall use all available methods to increase the quality of data to guide practices for improving the health of minors with gender dysphoria, rapid onset gender dysphoria, or other identity-based confusion who otherwise seek chemical or surgical mutilation. Section 4. Defunding chemical and surgical mutilation. The head of each executive department or agency that provides research or education grants to medical institutions, including medical schools and hospitals, shall, consistent with applicable law and in coordination with the Director of the Office of Management and Budget, immediately take appropriate steps to ensure that institutions receiving federal research or education grants end the chemical and surgical mutilation of children. Section 5. Additional directives to the Secretary of HHS. A. The Secretary of HHS shall, consistent with applicable law, take all appropriate actions to end the chemical and surgical mutilation of children, including regulatory and sub-regulatory actions, which may involve the following laws, programs, issues, or documents. 1. Medicare or Medicaid conditions of participation or conditions for coverage. 2. Clinical abuse or inappropriate use assessments relevant to state Medicaid programs. 3. Mandatory drug use reviews. 4. Section 1557 of the Patient Protection and Affordable Care Act. 5. Quality, safety, and oversight memoranda. 6. Essential health benefits requirements. And 7. The 11th revision of the International Classification of Diseases and other federally funded manuals, including the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. B. The Secretary of HHS shall promptly withdraw HHS's March 2, 2022 guidance document titled HHS Notice and Guidance on Gender-Affirming Care, Civil Rights, and Patient Privacy, and, in consultation with the Attorney General, issue new guidance protecting whistleblowers who take action related to ensuring compliance with this order. Section 6. TRICARE. The Department of Defense provides health insurance through TRICARE to nearly 2 million individuals under the age of 18. As appropriate and consistent with applicable law, the Secretary of Defense shall commence a rulemaking or sub-regulatory action to exclude chemical and surgical mutilation of children from TRICARE coverage, and amend the TRICARE Provider Handbook to exclude chemical and surgical mutilation of children. Section 7. Requirements for insurance carriers. The Director of the Office of Personnel Management, as appropriate and consistent with applicable law, shall A. Include provisions in the Federal Employee Health Benefits FEHB and Postal Service Health Benefits PSHB programs call letter for the 2026 plan year, specifying that eligible carriers, including the Foreign Service Benefit Plan, will exclude coverage for pediatric transgender surgeries or hormone treatments, and B. Negotiate to obtain appropriate corresponding reductions in FEHB and PSHB premiums. Section 8. Directives to the Department of Justice. The Attorney General shall A. Review Department of Justice enforcement of Section 116 of Title 18 United States Code and prioritize enforcement of protections against female genital mutilation. B. Convene State's Attorney General and other law enforcement officers to coordinate the enforcement of laws against female genital mutilation across all American states and territories. C. Prioritize investigations and take appropriate action to end deception of consumers, fraud, and violations of the Food, Drug, and Cosmetic Act by any entity that may be misleading the public about long-term side effects of chemical and surgical mutilation. D. In consultation with the Congress, work to draft, propose, and promote legislation to enact a private right of action for children and the parents of children whose healthy body parts have been damaged by medical professionals practicing chemical and surgical mutilation, which should include a lengthy statute of limitations. And E. Prioritize investigations and take appropriate action to end child abusive practices by so-called sanctuary states that facilitate stripping custody from parents who support the healthy development of their own children, including by considering the application of the Parental Kidnapping Prevention Act and recognized constitutional rights. Section 9. Enforcing adequate progress. Within 60 days of the date of this order, the heads of agencies with responsibilities under this order shall submit a single combined report to the Assistant to the President for Domestic Policy detailing progress in implementing this order and a timeline for future action. The Assistant to the President for Domestic Policy shall regularly convene the heads of agencies with responsibilities under this order or their designees to coordinate and prepare for the submission. Section 10. Severability. If any provision of this order or the application of any provision to any person or circumstances is held to be invalid, the remainder of this order and the application of any of its other provisions to any other persons or circumstances shall not be affected thereby. Signed, Donald J. Trump, The White House, January 28, 2025. This concludes the reading of Executive Order 14187, Protecting Children from Chemical and Surgical Mutilation. To stay on top of future executive orders, please click subscribe and allow notifications so you can be alerted when new recordings are available.